Hello and welcome. This is a presentation on anticipatory guidance specifically for infants by Bailey Vevon, Erica Woods, and Tara Wright for the class Nursing 8200, Child and Adolescent Nursing. This is baby Tiger. Tiger is 4 months old and is here at the office today with her mother and father for a 4-month-old well child visit. An important part of every visit is anticipatory guidance, in which you go over the expected growth and development for babies Tiger's age and safe practices at home with Tiger's parents.
Bright Futures provides a framework for health supervision with structured timing and evidence-based practices for the pediatric care provider to share with the parents. They are recommended for children from birth to 21 years of age. Specifically, in this presentation, we will discuss infants, which is one of the 5 subgroups. Within the infancy subgroup, it is further broken down into after birth, which is newborn, 1 month, 2 month, 4 months, 6 months, 9 months, and 1-year-old. We hope you enjoy and learn more about the anticipatory guidance in infants. This is the periodicity table, which is the recommended schedule of screening and assessments to be completed at each well child visit based on the 5 subgroups of age. Here is a closer look at the periodicity table for infancy. It is divided into multiple sections, as you can see. Measurements is one of the sections, which looks into height, weight, body mass index, and head circumference of your child. Sensory screenings will be performed, like vision and hearing. Developmental screenings for infancy include behavioral, social, and emotional screenings. A physical assessment will also be performed, assessing each of your child's body systems. Procedures like immunizations and anemia and lead tests will also be performed. In addition, oral health will be assessed, as your infant's teeth will start to erupt around 4 months of age. Anticipatory guidance will also be discussed at each well visit. For a 4-month-old like Tiger, they will need a bulk of what was just mentioned.
During each visit to your provider will discuss with you ways to provide the best care for you, your family, and your baby Tiger. As you can see on the slide, it's broken down into 4 categories: safety, development, family well-being, and nutrition.
Now, let's talk about the Survey of Well-Being of Young Children form, also known as the SWIC form. So, at each of your child's well visits, you may be asked to fill out a Survey of the Well-Being of Young Children form, which is here in this photo. This asks questions not only about your child's development, but also about your resources and your personal well-being. So this image on the slide is an example of one that you would be given at a 2-month-old well visit. There is one that pertains to the age of your child at each well visit that you attend. This one side of the sheet asks about developmental milestones and symptoms your child may be having, like stranger anxiety and sleep habits. The other side will continue into that, and then we'll ask you more about your personal well-being as well, and if there's anything that you would like to discuss about yourself that day.
Also, during your well visit, you will be asked various questions about you and your infant's home environment. Regarding food supply at home, you'll be asked questions like, do you have enough for you and your child to eat? Environmental exposures like tobacco will increase your child's risk of respiratory infections, ear infections, asthma, and slow lung growth. So, you will be asked if your child has any exposure to tobacco. Regarding safety of the infant's environment, you'll be asked questions like, do you feel safe where you live? And where does your child sleep? Regarding family relationships and dynamics at home, you'll be asked questions like, does the child have any siblings? Do you trust everyone you live with? And how is your relationship with your significant other? Regarding childcare arrangements, who will watch your infant when you can't? Will your infant attend daycare? Regarding maternal health and nutrition, how have you been doing since delivering? What do you eat on a daily basis? Regarding your transition home with your infant, the question could be like, do you have enough to help at home? And are you aware of the community resources that are available to you if you need it? Your pediatrician will discuss with you the milestones your child should be meeting along the way. Precautions based on age will be discussed with anticipatory guidance at each visit. These will be discussed further in the safety portion of this presentation.
Safety will be a big part of your child's well visit discussions. These are some of the big topics that will be further discussed on the next few slides. They include car seat safety, sleep safety, a safe home environment, touch supervision, burn risks, first aid, and infant CPR. A general recommendation is that the caretakers of the child, like parents and grandparents, should take a first aid and infant CPR class to be prepared in case something does occur. Keeping your baby safe can be and is a full-time job. Well visits with your provider can help you as a parent learn more about safety issues with each stage of your child's developmental and growth, along with anticipatory guidance that is provided. A very important safety topic to discuss is the use of car seats in infancy. In 2020, more than 63,000 children were injured in motor vehicle accidents. In 2021, 711 children passengers ages 12 and younger were killed. Of those children, over one-third of them were not buckled up. For children, a child should remain in a forward-facing car seat until they are 2 years of age and once they are 20 pounds. Never place your child in a front seat of a vehicle. Do not leave your child unattended in a car. Ensure that your child is properly restrained in their car seat. The photo on this slide discusses some important car seat safety tips. In rear-facing car seats, the harness strap should be at or below your child's shoulders. You need to adjust the car seat angle so the baby's head does not flop forward, as they do not have great neck control until they are a few months old. Harness straps should be snug. If you can pinch them, they're too loose. If it's cold, it is appropriate to place a blanket on the baby but over the straps of your child. Remove any of your baby's bulking clothing. Remove any headbands that could slip over your baby's face, and ensure that the chest clip is at the center of your baby's chest, level with your child's armpits. This slide discusses an additional safety topic in infancy, which is sleep. When your child is sleeping in a crib, the sides should be remain raised at all times. Slats in your crib should be no more than 2 3/8 inches apart from one another. Back sleeping is the preferred method of sleeping. Back sleep is preferred in that it reduces the risk of sudden infant death syndrome, also known as SIDS. Babies who sleep on their stomachs are at risk for suffocation. The Back to Sleep campaign was started in 1994, and it reduced the incidence of SIDS by 60%. The American Academy of Pediatrics also endorses the Back to Sleep campaign. When your child is sleeping, ensure that the room temperature is comfortable for them. Never leave your baby in a mesh playpen or crib with the side down. Your child should be sleeping between 10 and 17 hours, depending on their age. Ensure to check for recalls on nursery products at saferproducts.gov as well. Keeping everyone safe at home keeps everyone happy, including your infant. By doing this, you should keep an eye on your child at all times. Do not leave your child unattended when up high, like on a changing table. Check your home for lead poisoning hazards like chip paint and lead water pipes. Ensure that environmental hazards like cleaning supplies and medications are locked up. Ensure that guns are locked up and not loaded. Baby gates should be utilized to protect your child from stairs and off-limit areas. Do not leave your child unattended around water, including pools, lakes, and bathtubs. Install smoke alarms throughout your home and ensure the ones that are already there are in proper working order. And know the number to your local poison control. You can post this in a very general neutral location in your house and even have it as a contact in your cell phone. Some developmental milestones that are pertinent to this slide are children start to grasp around 4 months of age, meaning they will grab onto things and start pulling them to their mouths. They will begin to roll over by 6 months old and will start to crawl and pull themselves up by 9 months old and should be walking by around 12 months old. This is especially another reason why you should keep an eye on your child at all times and ensure that these points on the slide are focused on. You can never be too safe at home. This slide will discuss weather, burns, and choking and keeping your child safe. Setting the hot water temperature in your house to below 120 to prevent burns from hot water is essential. Prior to bathing your child, use your wrist to test the temperature of the water first. This ensures that the water is not too hot. Try to limit the time spent in the sun, but if you must spend time in the sun, SPF 15 or higher should be placed prior to the exposure, and your child should wear a broad brimmed hat to avoid any kind of facial burns. Do not leave hot food or liquids unattended. Your increasingly mobile child could pull them down and burn themselves. Keeping small, loose objects away from your child will help prevent them subsequently swallowing them and potentially choking on them. At least one child dies every 5 days from choking in the United States. This slide discusses family well-being specifically for the parents. It is important to not only establish a routine, like a bedtime routine, to discourage nighttime waking, but in order to have some sense of routine back in your life when you have a young infant in home. Maintaining a support system can help give you an outlet to express feelings and emotions, and who is there to lead a helping hand for you when needed. It is important to encourage sibling interaction so they can start to begin those sibling relationships, and they can start beginning on learning how to share. Seek help for depression. Suicide is the number one cause of death 1 year postpartum in mothers. Postpartum depression affects around 15% of mothers. It presents with emotional highs and lows, frequent crying, fatigue, guilt, anxiety, and those that experience it may have trouble caring for their baby. It's also important to sleep when your child sleeps. It might be tempting to use this time while your child is sleeping to catch up with other housework and chores, but sometimes getting rest and having a clear mindset is just as important. If you feel that you're worried about sleeping too long, it's okay to set an alarm.
Next, let's talk about the parent-infant relationship, the child's emotional world. Nurture your baby by holding, cuddling, and rocking her, and by talking and singing to her. Encourage your baby to vocalize. Talk to her during dressing, bathing, feeding, playing, and walking. Read to your infant. Play music, sing to her, and stimulate your baby with age-appropriate toys. Your nutrition is as important for you as it is for your infant. What you eat provides nutrients for your infant. Even if you do not breastfeed, you need to be healthy and strong to care for your little one. Please avoid smoking tobacco, drinking alcohol, and using recreational drugs, especially while breastfeeding. Eat a healthy diet with plenty of fruits and vegetables. Drink plenty of water, and limit caffeine intake, especially if breastfeeding. How and what you feed your little tiger is very important. It is your infant's foundation for health. As part of each health supervision visit, your provider will help you make decisions about feeding based on your infant's age and weight. Studies show that breastfeeding provides the best nutrition for your infant. Formula feeding still will provide the infant with adequate nutrition, but discuss with your provider whether or not your infant needs vitamin D and iron supplementation. Make sure you're holding baby in semi-upright position when feeding so they don't choke on the milk or formula. Never prop the bottle, like in the picture on the bottom right of the slide, because it can lead to dental caries and otitis media. Only put formula or breast milk inside the infant's bottle so they don't ingest something they shouldn't. No Caro syrup, honey, or whole milk or any items in the middle picture for the infant before 12 months. At 6 months, you can begin giving little tiger solid foods. Introduce only one food at a time. The picture in the upper right-hand corner is an example of what not to give to an infant. Also, after 6 months, an infant can begin to drink some water in a sippy cup. Before 6 months, the child should only be drinking milk. Juice is not recommended for children until after 12 months of age.
Now, let's talk about your infant's poop. Patterns may vary in your child's bowel movements. As an infant, their stools will progress from meconium, which is a sticky and dark green like stool, to more of a yellow, watery stool. Expect your infant stool to change if switching from breast milk to formula and when introducing new foods. The image on this slide shows normal colors of stool in babies and those that are concerning. Blood in stool may be a sign of a milk allergy. These are some general health tips for your infant. Make sure you are changing their diaper frequently to prevent diaper rash. Using a barrier cream like Desitin can help prevent this. Brush their gums with a soft toothbrush twice a day. When they develop teeth, you may also brush those. Avoid leaving a bottle or pacifier in their mouths so they do not have a gap in their teeth. Use fragrance-free soaps and lotions. Do not bathe your child until the umbilical cord falls off. Ensure that you're keeping the cord nice and dry to avoid infection. Know your pediatrician's phone number, whether this is posted on your refrigerator or as a contact in your phone. Make sure that you are washing your hands often to protect your child from getting any sort of infections. And never, ever, ever, ever shake your baby. There are around 1,300 cases of shaken baby syndrome each year in the United States. Around 80% of those cases will suffer with lifelong disability. This slide of the presentation goes over reasons why you would want to contact your pediatrician. Starting with the top left reason. So if your child is 3 months old or younger and they have a fever of 100.4 rectally, and if your child is older than 3 months and they have a rectal temperature of 102.2 or greater rectally, that would be a good reason to contact your pediatrician. If they have a seizure or you notice a skin rash or purple colored spots on your infant, if you notice any change in activity or behavior that makes you uncomfortable about your child, if your child develops unusual irritability or lethargy, if they do not want to eat, if they're profusely vomiting, and if they have diarrhea, if they develop jaundice, which is a yellowing in the color of their skin, if they have any signs of dehydration, you may notice dry, cracked lips or kind of a dry, cracked tongue and a decrease in their urine output. If your child becomes apneic, in which your child is having periods where they're not breathing. If you notice any respiratory distress in your child, in which they are breathing very loudly, rapidly, or you notice that they're having to really work to breathe and they're using more muscles to breathe. The final reason why you should contact your pediatrician is if you notice cyanosis, and that's in which your child will develop a blue coloration to their skin. You might mainly notice it around their lips, maybe the tips of their fingers, their hands, their feet, and that can indicate that actually they are not getting enough oxygen, and that would be a reason to contact your pediatrician.
Here are some community resources for you if you need them: the National Domestic Hotline, Nurse Family Partnership, Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as the WIC program, and tobacco use cessation help from the Centers of Disease Control and Prevention. Information for this presentation was obtained from the Burns Pediatric Primary Care Textbook, Dutterstat Pediatric Physical Examination Textbook, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, and a few other notable sources. This was a presentation on anticipatory guidance for infancy. We hope our information was clear and helpful for you as you seek to care for your loved one. Thank you so much for watching. Have a nice day.